I realize I have not posted in quite some time. We have been, we've had a very crazy last several months between the farmer's market this summer and then me being pregnant. I am currently full term, 38 in some days, so I could have this baby any day now. So for my own recollection, and for those out there who are curious or have had a baby and are looking at their second pregnancy or something along those lines, I figured I would kind of run through what my experience has been with this second pregnancy, and just kind of recap everything that has happened over the course of the last several months. So found out I was pregnant back in January, February-ish. Waited a little while to tell anybody, just making sure that everything stuck, because I'm not 100% sure, but I'm pretty sure I had a really early miscarriage. And so, didn't want to say anything too soon. So, but I was in fact pregnant. Everything stuck. Everything was good. Baby has been growing and healthy. No complications. No issues. I had a feeling that I was pregnant before I was actually able to take a pregnancy test, just by the way I was feeling. I was having all of the symptoms, the nausea, and all of that sort of stuff, which was interesting because with my daughter, I didn't really have much for nausea. This time, the nausea was significantly worse. And I actually had a morning that I threw up because of the nausea. So, thankfully, it didn't happen very often. I was able to stay well hydrated, and I was able to eat so that, I didn't end up with any severe issues. Was just really uncomfortable. It was really unpleasant. And I actually remember telling my boss, because I had told her that we were going to be trying to have another baby. And I had told her, I said, either I'm pregnant or I'm coming down with something. Like, that's the only explanation. And lo and behold, I was pregnant. All of the symptoms were just kind of amplified from what I dealt with my first pregnancy. It was kind of the same thing. I had some body aches here and there, and that sort of stuff. But it was like the dial was turned up on everything. So everything was more intense. Everything was, just more of a struggle to manage and deal with. I was actually having like food and smell aversions. So like when my husband would feed our dog, for a little while there, I couldn't actually be in the same room because I couldn't stand the smell of the dog food. That has thankfully kind of gone away. Every once in a while, I'll have like a smell that's just, it's really strong, that I'm just kind of like, no, don't like it. But not to the point where if I stay here, I'm going to start vomiting. It's just kind of like I don't like it kind of sensation. So first trimester was probably the most challenging in that regard. Second trimester, end of first trimester into second trimester, the hardest part that I was having was how uncomfortable I was, because my body was changing a lot faster and a lot sooner than I had dealt with my first pregnancy and anticipated from this one. So with my first pregnancy with my daughter, I was able to continue wearing my regular work pants up until like the day I delivered her. Got to the point where having that much pressure across my belly was really uncomfortable. And so I actually had to start wearing maternity pants really early on, probably like just barely out of my first trimester into my second, just starting my second trimester, because of how uncomfortable I was. And I was actually having to walk around and like hold my pants away from my belly, because otherwise it would feel like I was being crushed. Just very, very sensitive too. Because it wasn't even so much that my belly had actually grown that much. I was just really sensitive to pressure through that area. So I've been wearing maternity pants for the last 7 months, 8 months, something like that. Or, yeah, 7 months. So, second trimester, like I said, the biggest thing was just like the physical body changes. I dealt with a lot of like pelvis discomfort, and just from the relaxin kicking in and everything starting to get kind of loose and that sort of stuff. So I dealt with a lot of that during the second trimester. During my, I can't remember if it was end of first or beginning of my second trimester, we decided that because there was, from the couple OB appointments that I had had, everything was good with baby. Baby was healthy. I'm healthy. The only risk factor, and I'm going to put that in quotations, is the fact that I am over 35 years old. So because of that, outside of the fact that I'm not obese, I don't have high blood pressure, I don't have diabetes at a baseline, I did not have gestational diabetes with my daughter, I don't have any chronic illnesses outside of my hypothyroidism, which is no big deal, because I really have no risk factors for this being a complicated or complex pregnancy or birth. I started looking into doing a home birth with a midwife, and found a gal. She lives about an hour away from us, but she services kind of an hour radius from her home. So, you know, we're well within her range. I was feeling really good about just the alternative of doing a home birth with her versus doing another hospital birth. I can do a whole nother video on my first experience with my daughter, but it's very much like, well, to put it in my midwife's terms, because when I first talked to her, I explained to her what had happened, and because she had asked, you know, why are you looking for a home birth? You know, what's your motivation? And so I explained to her what my experience had been with my daughter giving birth in the hospital, and everything that had happened, and whatnot. And she said, you know, not to downplay your situation, but she said, it sounds like you had a very typical hospital birth. Like, yeah, I don't want to do that again. Once was one too many, really, in dealing with what, you know, everything that happened, and how all that went down. So, you know, we're going the home birth route. It took a little bit, but finally got my husband on board. A couple clinic appointments at the hospital for like getting some blood work done, and you know, doing some screening and things, which is fine. Those were things that we wanted to do anyway. But the OB, I think I've seen her twice now. She has been very helpful and very understanding. She's made it really easy to kind of have this, you know, more holistic side with working with my midwife, but being able to kind of utilize and touch on the medical side and the medical services. I really enjoyed working with my midwife. One of the biggest differences that I will say here between my first pregnancy and this one, you know, working with your regular doctors in the, you know, Western healthcare system versus working with my midwife, is there's a lot of things that I've noticed that when it comes to pregnancy, and whether this is because of lack of time to be able to kind of investigate into some of this stuff, or if it's because of, unfortunately, lack of payment and reimbursement for doing some of the things that can really help with some of the challenges and symptoms of pregnancy. A lot of the response that you get from, you know, your OB visits related to, like, how are you feeling? Well, I'm tired. I'm, you know, not sleeping well. I'm this, that, and the other thing. They'll have a couple suggestions here and there, but for the most part, the response is usually, it's pregnancy. Like, this is this is what happens when you're pregnant. And it's just kind of like, you just kind of got to deal with it. Eventually you're not going to be pregnant anymore, and this will all change, and, you'll move on. However, with my midwife, my experience has been very, very different, because every time we talk about something like, I've had a ton of pelvic pain with this pregnancy, or difficulty sleeping, or just feeling like really tired, like beyond what I should be for pregnancy, like really tired. My midwife has a suggestion and a solution, and every single one of them that I've tried has worked. She has a lot of really good suggestions for like stretches and muscle and tissue releases, and all that sort of stuff, just to minimize the discomfort that you end up having with pregnancy. So that has been awesome. I really, really appreciated that, because now whenever I bring something to her, if I want it addressed, I know to bring it up to her. If I don't want to do anything about it, or if I don't want to try to fix it for whatever stubborn reason, then I better not say anything, because she's going to have suggestions. She's going to have, potential solutions to work through some of this stuff. And at least, we might not be able to get rid of the issue completely, but at least minimize or mitigate how much discomfort and whatnot that I deal with. So I feel like that's probably been one of the biggest differences between my first pregnancy and this one, is she always has a suggestion or a solution for everything. Although this has been by far, between my two pregnancies, this is by far the harder one. It's made this one tolerable, because I know I have solutions. I know I have ways to minimize and mitigate some of the discomfort and these various other symptoms that come along with pregnancy. It's just, it's been really, really helpful in that regard. Per the suggestion of my midwife, I've started seeing a chiropractor, because I had a lot of back labor and continued back issues since my daughter. And my midwife suggested that, that I go see a chiropractor fairly regularly, just to kind of keep everything moving, and, so it doesn't get locked up and, create problems later. So that's what I've been doing, and that's been extremely helpful as well. So I've been continuing that through my third trimester. Third trimester has just been a lot of belly growth, putting on more weight, mainly with baby and having this big bowling ball in front of me. I weigh more now than I ever have in my entire life. I have never weighed this much, and I'm just gonna let that go for right now, and we're gonna ignore that, and because I'm a lot more swollen with this pregnancy. Like, I can't wear any of my rings anymore. We had to get a silicone wedding band for me, because I couldn't wear my wedding ring, and I did not want to have it cut off at some point, because there were times where it was getting uncomfortable. Everybody's like, oh, you're all belly, and I'm like, no, I got a lot of swelling up here. I've definitely gained some weight up here. So, but it is what it is at this point. I just want to make sure that the baby is healthy and that everything goes well. So home birth is still planned. I am now down to weekly appointments with my midwife. So I saw her last week. I just saw her this morning, and then we have one scheduled for next week if I don't deliver. I met with her and just kind of talked through, like, with my experience having significant back labor with my daughter for hours, and not really getting any suggestions or solutions on what to do about it, whatever. Had that conversation with her about, like, okay, what do we do? What happens when, something is, not going well. And so she had a great list of like, we'll try this, we'll try this, we'll try this. If you're telling me that this is what you're feeling, we're not going to wait. We're just going to start doing some things, whether that's some repositioning to, you know, take off some pressure and, you know, move baby a little bit, or we're going to do this to help you relax and all that sort of stuff. And in that conversation, and after thinking about it afterwards, I realized that although I've given birth before, this is going to be a whole new experience. Like, this is going to be something completely different than I have ever done. And I did with my hospital birth, because of how she's going to be approaching things and addressing stuff with me, and, you know, as labor progresses and what happens. And that honestly has really provided me with a lot of peace, I would say, in regards to giving birth this time. Because when we were trying to get pregnant, and I did actually get, you know, I did confirm that I was pregnant, that was honestly my biggest fear, was I don't want to have the same experience that I had with my daughter. This third trimester, I've been thinking a lot more about the actual labor and delivery, and just kind of getting myself into that mindset of like, you've never done this before. You know, I can't keep comparing this to delivering my daughter, because this is a totally new game, totally new situation, totally new approach. Like, everything about how we're going to be handling this is going to be different. And so that in itself is providing me with a lot of peace, knowing that, like, okay, I may still have, you know, a lot of the discomfort, and, you know, nobody ever said that, you know, giving birth is easy, right? People will say like, oh, it was my easiest delivery, you know, but not that actually giving birth to a child is easy. You know, just kind of that mindset and that mental shift of like, I've never done this before. I've never gone through this particular process. I've never taken this particular approach to labor and delivery. Like, this is totally new. And listening to like other moms who have done home births, and just kind of the differences between, especially first and second time deliveries. I've been getting some pretty, I don't want to say consistent Braxton Hicks, because Braxton Hicks by nature are not consistent, but been getting regular Braxton Hicks. So pretty much every day I'm having at least a couple Braxton Hicks. You know, I'm probably even having more than I'm noticing, because what I'm feeling is just like a tightness around my belly, and unless I'm either not really doing anything, I'm intentionally paying attention to it, or they're intense enough, I don't really notice them, you know? They're very much like, it just feels like somebody took a rubber balloon and stretched it over the top of my belly, and then it's just squeezing. And I would say it's no different than doing a plank, but not a very long one. Any day now, baby, you can come out. I would not be disappointed or upset if I actually went into labor today. Some of the Braxton Hicks that I had yesterday, like, actually created some more pressure and discomfort in my peri area, which is a little bit different than what they had been previously. They've just been like up around my belly area, and now it's like, oh, that's new, you know. But still, you know, not happening consistently enough where it's like, okay, yep, I'm definitely in labor, so here I sit. So thank you all for listening. That's how my pregnancy has gone, and hopefully in the next few days here, I will finally go into labor. I will deliver this baby, and after I have had some time to rest, regroup, kind of get my thoughts in order, I will do another video about how this home birth goes, what the experience is, what happens, and yeah, so we shall see. But thank y'all very much, and hope everybody's having a fantastic day, or had a fantastic day, depending on when you're watching this video. And I'll see you soon.